Hi, and welcome to this edition of Breastfeeding Buddies. Today we're going to be talking about some of the common stories and myths that circulate about breastfeeding. A myth is something that's commonly believed but not based on fact, and we want to make sure that moms have all of the correct information so that they can make an informed choice about how they want to feed their babies. Today we're going to be going through some can I breastfeed if situations and hopefully dispelling some of these myths. So the first one is breastfeeding twins. And definitely, yes, moms who have twins can breastfeed both of the babies. It may be a little bit more challenging, but moms will make enough milk to feed more than one baby. If sometimes moms aren't able to breastfeed right away when they have twins, and if that's the case, then moms oftentimes will need to pump a little bit in the beginning to bring in their milk supply and bring in a good milk supply. Moms also may need help with feeding schedules. In the beginning, it might be a good idea to keep some charts and graphs and write down when each baby's feeding, the number of pees and poops, just to help keep track of some of that information in the beginning. And also maybe some help with positioning ideas and different ways that both babies can be fed at the same time. Another question that comes up a lot are tattoos on the breast, and definitely yes, moms can breastfeed if they have tattoos. The ink does not enter or affect the breast milk in any way. Nipple rings are another question, and yes, moms can breastfeed if they have a piercing in their nipple. The rings won't affect the quality or quantity of breast milk, but they do need to be removed before a mom feeds so that it's not a choking hazard for the baby. Some moms will find that milk actually comes out of the holes where the piercing was made, which is absolutely fine, but definitely not a reason someone couldn't breastfeed. Diet and eating junk foods is another question that comes up, and yes, moms can definitely breastfeed if they don't have a perfect diet. Moms who eat a poor diet will definitely produce healthy milk. What happens when the diet if mom's not eating a good diet, is that she might feel more run down and tired because what the breast milk isn't getting from the foods that she's eating, it will be taking from her nutrient stores in her body. So she's just going to feel a little bit more run down. It's interesting, though, that when an infant feeds from the breast, there's an outpouring of 19 different GI hormones in both the mom and the baby, which actually stimulates growth of the mom and baby's villi in the intestine. And villi are finger-like structures that come off of the surface of the intestine, so that increases the surface area and allows more calories and nutrients to be absorbed. Another can I breastfeed is using illegal drugs, and that is a no for breastfeeding. Drugs can pass into the breast milk and get to the baby and could cause harm. Another one is when the mom is pregnant again. This is called tandem nursing, when a mom is nursing two babies that are not from the same pregnancy. If you do get pregnant while you're breastfeeding, it's important that you talk with your doctor. It is kind of a natural weaning time for a couple of reasons. Some moms do experience some sore nipples when they become pregnant again and are breastfeeding. After delivery, the milk also reverts back to colostrum, which is that yellowish, thicker liquid for a newborn. And so the older infant may not like the taste since it tastes a little bit different, and there's also a much smaller amount that's produced. So sometimes they'll just naturally wean during this time. But moms who do continue to nurse two infants do need to make sure that they're nursing the newborn first and frequently, and find time for other non-nursing interactions with the older baby, things like reading books and playing games and that type of thing. Premature babies is an absolute yes. Breast milk is medicine for these little tiny babies. Moms are encouraged to pump as early as possible when they deliver a preemie. The milk actually provides high amounts of certain vitamins and infection-fighting agents that are very important for these little ones, so definitely a yes. We also get questions about breast surgery, and most of the time moms can breastfeed fine. You do need to talk with your doctor if you've had any breast surgery and let them know what you've had done. And your doctor will do a prenatal breast exam and follow you closely after delivery to make sure the baby's getting enough. Your ability to exclusively breastfeed will just depend on how the surgery was done and if any milk ducts were cut in the process. Moms always worry about breast size, and if moms have smaller breasts, they definitely can breastfeed. Breast size doesn't determine milk supply, and moms have all of the milk-making equipment regardless of the size of the breast, so definitely a yes. C-section, a yes as well. Moms need to do skin to skin and breastfeed as soon as they can after delivery. Some moms might find different holds work better when they have a C-section, like a football hold where they hold the baby off to the side, and that way the baby's not laying across that incision if she's a little bit sore. One question we get a lot is use of marijuana, and it's not recommended that you breastfeed if you are using marijuana. The THC, or the active ingredient in marijuana, can cause things like poor sucking in the infant and motor delays, things like a delay in crawling, maybe a difficulty grasping finger foods. The active ingredient passes into breast milk and moves into the baby's fatty tissue, which includes their brain. And pumping and dumping, unfortunately, does not work because the THC stays in your body for a long time. Like a mom might have a positive urine test for up to 2 weeks after she smoked marijuana. So just because we don't know all the dangers of using this drug, the American Academy of Pediatrics recommends that breastfeeding moms avoid marijuana. Some moms worry about their stress level and that it might spoil the milk, or that it might affect the amount that she makes. And stress itself doesn't affect milk supply. So even if you have a stressful life, you can still breastfeed. One great thing about breastfeeding is it actually helps calm the mom. There's a hormone that's released, it's called oxytocin, and that actually helps calm the mom. And the mom also, if they're breastfeeding, you have to sit down with your baby and spend that quality one-on-one time. So it actually can be kind of a stress reliever for moms that are for those moms living a busy life. And then the last one is medications, and I'm going to say yes or no for this one. You definitely need to talk with your doctor about what medications you're taking if you are going to breastfeed. There definitely are varieties that are safe to take. One of the best resources is called the Infant Risk Center, and you can Google that, and it's a great place to find out information about medication use during breastfeeding. They have a website, and there's also an app that you can put on your phone and a phone number that you can call and talk to a live person about the medications that you're taking to see if they're safe. So thank you for joining in today to Breastfeeding Buddies, and we hope that you'll join us again next week, same time, same place, next Tuesday at 10 o'clock. Thanks so much for joining.